Ladies and gentlemen, good afternoon. Please take your seats for the final session at this year's European Health Forum Gastein. Welcome to this final plenary, the European Health Data Space from concept to reality. Welcome to having made it all the way through the European Health Forum to our final focus, the final D, our focus on democracy at work and data underpinning all of this. So this session is going to be a very interesting session. We're going to go through outlines of what the European Health Data Space involves, and I think this is really important, to really turn it into reality through understanding of the challenges and also the potential through our august panel of speakers and contributors who I will introduce as we go through. But we are still very keen also to have your input. So in addition to Floris and the cartoons summarizing the discussion as we go through, Mario Jędrosek from the Young Forum Gastein is in the newsroom monitoring Slido for your comments. Mario is just there. We hope that you will make your comments by going to Slido. And I'm sure you're all used to how this works by now. The keyword is DUNE, capital D-U-N-E. I don't see anyone immediately reaching for their phones, but feel free to reach for Slido and put in your comments and your reactions, and we will take those as we're going through. It's good to get out of the way right at the start. And in fact, I'm going to get out of the way, colleagues, because there's someone much more important who I want to introduce. So I said we would set the scene. I know all of you have been reading about the European Health Data Space, but just to refresh your memories, it's my pleasure to introduce Marco Marcella, who is the Director of Digital EU for Health and Health Systems Modernization in DG SANTE of the European Commission. You all know him already, I think. Marco, please come to the stage.
Yes. So good morning all. Thank you, Nick. Yes, I think that I abused the presence in some sessions, but this one I have to say that I am privileged, very privileged, to attend and to provide some important messages. And this is because I am, the Commission, so we worked so hard for creating what we believe it is a transformative initiative for healthcare in Europe. It's transformative because there are elements that we can use to reshape how healthcare is going to work across the European Union. Now, it is a regulation, but it is a regulation that is more than a framework. It's more than, say, a policy shift. It is a vision. That's how we believe we would frame it. It is a vision on how we can harness health data trustfully, the power of health data to enhance the well-being of citizens, to improve healthcare systems, and eventually to foster innovation in Europe. Now, it is a regulation, but it is a regulation, if I may stress, that empowers. It will empower the citizens to have access and control their health data across the European Union. It will empower healthcare professionals to access seamlessly the data, and it will empower regulators and researchers and innovators to make the best out of it. Now, all of this in full respect, European values, GDPR, and ethical principles. Now, we are today one step closer to get the regulations approved. You all know that there was a political agreement reached by the co-legislator early next year. So we expect the formal adoption of the legislation, say, towards the end of the year, say, the beginning of 2025. And it is the European Health Data Space, the first of what we call European data spaces under the data say, the data strategy of the European Union, and it is a key pillar of the European Union Health Union. Now, it is, again, more than a policy initiative, because we strongly believe that this is a commitment that we are putting to our citizens' health, to the well-beings, and also to their rights. Now, to shape, say, the discourse, there are three main elements that are covered in the regulation. The first one is what we call primary use of data, which is essentially using medical information to provide healthcare services from the individual for whom that information is collected. So I go to a hospital and I get information that I can use, again, across the borders. We have the second pillar that is reusing data in aggregated form, totally in line with the General Data Protection Regulations and securely accessed so that these can be reused for, again, promoting innovation, for instance. And the third element, which we heard already these days, it is an element that tackles the issues of interoperability of health data within the European Union. And we do that through the definition of what we call the European Electronic Health Record Exchange format, which is, in a way, systematizing and clarifying the way in which information can go between information systems in Europe so that I can package and I can also open it up and understand what is in there. We will have the first 2 years working on technical implementations and guidelines, and then we will have another 2 years to implement them. So we will go in full speed in 2028, but this doesn't mean that we are not yet working on it. To the contrary, we build on the work that has been, probably many of you have already been associated with it. We are already building infrastructures for voluntary exchange of data, such as e-prescriptions in the European Union. Those infrastructures are built at the European level and connect with those that are developed in the member states. We will do the same for the secondary use of data. And now, say, the central effort of this powerful regulation is that we do have these commitments in protecting the citizens' rights and also the privacy of the health data. These are the bedrock of that information. So this is not about creating a centralized repository of health data, but rather making sure that the data stays under the control of those who own it, and the flow is done in a lawful way. Now, just to close this, setting the scene, the European health data space is not just about technology and technology development, but it is about trust, it's about collaboration, and it's about a shared vision that we all collectively contribute to shape. And it's only through these three elements that we will really contribute to, say, revolutionizing the way in which care it is developed and mainstreamed in Europe. And therefore, I would like to stress this element that the success, it will really depend on the commitment of everyone that is involved. And as we call the stakeholders here as very diverse, and we need the help of everyone to make sure that we can take this transformational initiative and make it a reality. And we do have all the elements to make sure that this happens. So let's work together to make sure that we do it. Thank you.
Thank you very much, Mr. Marcella, for that overview and that reminder. And I'm very struck by how you turn this piece of legislation, which is quite a big and quite a complex piece of legislation, into an articulation of a vision of trust, of empowerment, and of being able to really use data in a way that will bring benefits to patients and to health systems across Europe. Let's now get into what the real situation is now and what those benefits might be. And it's my pleasure to invite two expert perspectives on that. to come to the stage. Birgit Bauer, who is patient expert, project leader and founder of the Data Saves Lives initiative in Germany, and Luis Marti Bonmati, who is the scientific coordinator of EUCAIM, the European Federation for Cancer Images, as well as being head of the radiology department at the La Fe University and Polytechnic Hospital in Valencia, Spain. Please welcome our colleagues to the stage, everyone. So, we've heard about the vision that Marco's described, and also the need for collaboration, the need to really make a difference in practice. So let's start by discussing the current situation before we get to this, the brave new world of the European health data space. Birgit, to what extent is the data that you need and that patients need collected and shared between all the relevant people within your country, for example?
So I would say we need all the data and we need to share all that data. But in Germany, we have some things to do. At the moment, there is a new data bank under construction. What is the authority comes up next year, and they will be responsible. It's called the Forschungsdatenzentrum. It's a little bit typically German, but it will be under the umbrella of the authority, and it will be the relevant a place to ask for data, and they will share the data. So they will store, and you have, if you want to have data, you can go to them and ask for it. So this is the simple and short version. But I think at the moment, it's under construction. It needs to be done or there are some missions to be done. There is some homework. And I guess we will have it next year in place. So we will know more maybe in 2 weeks as we do a Data Saves Lives online session about this with some representative from the Forschungsdatenzentrum Gesundheit.
So this is still very much a work in progress even before the European health data space. What about the situation in Spain, in your situation?
Well, I will summarize. Well, first, thanks, Marco, for that overview and pushing the European health data space, which is mandatory. We all recognize that data belongs to the patient, but it's stored at the hospitals, and it's not moving where the patients go. So we need for primary use really that patient summary and e-prescription pathway to be pushed. But most important for research, that's mandatory. Every way we perform in clinical practice is based on previous research and innovation, and it's mandatory to avoid those many challenges we are having today. Technical barriers, that mean the hospitals, their warehouses are not mature enough. That's the situation all over Europe. Also, data is not harmonized and structured on the right way, on the similar way. Semantic interoperability, technical communications has to be pretty much defined. There are legal barriers all over based on limitations for data transfer and data sharing, risk assessments, and so on. And the situation, although it's normalized all over Europe, on the different countries, there are different situations. In Spain, we are proud that we can ask for data for secondary use on a broad base, meaning not on quite specific topics. So we can get access to data in an easier way. We are not so strict on the data safety and protection as other countries, because we understand anonymization de facto can be done, and we are doing pseudonymization and anonymization on the right way. As an example, most of the things we are implementing on the infrastructures we are related with, like EUCAIM, the European Medical Imaging Infrastructure, are heavily based on what we are pushing and doing in Spain.
Thank you. So it sounds like a lot of work has already been done, but the situation is not perfect. So I think there's still clearly benefits to come from this. Birgit, the title of the initiative is Data Saves Lives. So I understand that there's a potential there. But can you give us some tangible examples? What might patients be able to expect to get out of something like the European health data space if it in their patient journey?
Yeah, so I would say we have more knowledge. We can learn more about diseases. So maybe we cannot cure all diseases in the future. Might be, I don't know. But we can do more research. We can also develop better medicines or therapy options too. I think that's important. And patients expect that, because some of them suffer, especially rare disease patients have such a long time to be diagnosed correctly. And also in the field of MS, we know that patients wait for a long time for having a good diagnosis in their hands and also can make a choice. And this is also a question of quality of life. So when we have enough data and when we can do enough research, then we can grow quality of life, but it's also an economical thing. If you have enough data, you know more and you can be more efficient in the healthcare systems. And this is also a question what keeps patients busy, because we have to pay more and more for our health insurances. This is the other question. And the other thing is, Marco mentioned already the European health record exchange format. I'm in a research project in that way already, and I love that format because for me it would be so great to be on travel in another country and I can share my health data with a doctor I don't know, and he doesn't know me. It would be such a relief for me to know that I can have care without telling my healthcare story in 2 or 3 minutes, because he has maybe not the time, and also to receive the care I need. And so we have language problems. So I can order food and drinks in Italian fluently, but I'm not able to explain MS in Italian very fluently. But to be able to share my data with that format enables me to travel with not so much problems and issues, and maybe also not with that much preparation I have to do when I go into another country. This is the burden what you have as a patient living with a chronic disease. And I think this is something we really want to have, also for the patients and the citizens, because when you become sick in another country, you need help.
Thank you. So I think this is the first time I've heard someone on a panel say that they love a data format. This is a new, but it's because of the benefits that you describe. So both the immediate benefits to care of the patient, but also the benefits from the secondary care. And Marco described these 3 pillars that you've just brought together in your answer of the interoperability, the primary use, and the secondary use. And there are benefits from patients for all 3 of those dimensions of the EHDS.
Yeah, I think this is much important, but what we have to do is also to explain it to the people, because lots of patients don't see that at the moment. They don't have any clue what is in it. So they see just, oh, that's a new law, new framework, lots of things to do. The experts talk something about it, but we don't understand it. So we have to make sure that we communicate it out and then also share the knowledge with the patients and make sure that they understand what's going on. And I think when we talk also about trust, this can be a big part to generate trust and also to bring people on board.
We'll come back to both of those points of trust and of awareness raising, I think, as we continue the discussion. But so from the patient perspective to the professional perspective, both from the aspect of primary care data sharing and also from the secondary usage that we're describing, what are the benefits? How can this contribute to more accurate or more timely healthcare interventions, do you think?
Well, we have to recognize that medicine is a changing field. No? We try to improve every day. So we have to incorporate improvements into clinical pathways. And we have to recognize that the primary healthcare assistance is extremely enhanced and shaped by what is done in research and innovation. And to do that properly, to allow research and innovation to make a revolution in the delivery and access to the highest quality healthcare, the use of data is mandatory. I mean, we need a huge amount of data of the largest quality. And that means that we have to build and validate our predictions, models, tools, panels, understanding biological and physiological processes behind the disease, mainly these days using AI, which is one of our most powerful tools, that needs data of high quality and quantity to foster our understanding on what's happening and also finding the best treatments. And to do that properly, I mean, of course, we need that European Electronic Health Records Exchange format. That will be something extremely relevant. But we need also to deeply go into data interoperability. I mean, information, how the information is shared and understood and communicated. We need data harmonization. I mean, there are different types of machines, devices, acquisitions, units that have to be harmonized. Otherwise, the tools will not work on a reproducible way, and reproducibility is mandatory. And of course, we need to empower citizens by allowing them to have access to the highest quality medicine.
Thank you, that's very clear. So there's a lot of potential there, but I'm sure it provokes questions. Mario, are there, I can imagine that there might be questions about this vision, as it were. Are there any reactions you'd like to draw to our attention?
Yeah, the discussion is quite lively on Slido. So a few points stand out. One is the question of realism. Do we believe that EHDS will make a difference given the current gaps of digitalization in healthcare? So that is maybe the question number one, realism. And question number two, sort of related, is about implementation. How do we make sure implementation makes it easier to access data, and how do we avoid having countries making bad choices in implementation?
Thank you. So we have these two strands of how realistic this is and about how well we can implement this. And I think, in particular, implementation is something that we will discuss a bit more when we come on to the second panel discussion. But I'd welcome your thoughts on realism, Birgit, because the first question I asked you was, and you said, well, there's a lot being constructed at the moment within Germany. How realistic is it? You know, how big of an effort do you see? So Marco described a sort of a several-year timetable. You're involved in European projects. How realistic is it that we're actually going to see these benefits from the EHDS coming through in practice?
Well, I'm following this discussion not since 2 years, it's many, many more years. So I heard from the first vision, and now we are here. And there are some things happened already, and this is a good sign. And to be honest, I'm one of those, realistically, I think it is realistic. And we have to do it because we have so many needs outside. We can't fulfill with this what we have at the moment. We have to move forward, and we have to find new ways. And this is what I see. Therefore, it is realistic. Yes, it will be challenging. We have a lot to do still, and I think this will not change over the next 5 to 10 years. But to be honest, we do it for the people. We do it also for a common good, for a greater good. It's not just for 10 people or one country or so. It's for all living in Europe. And this is also what we have to think about. So maybe it's a bit visionary. This can be, and maybe I'm a dreamer, I don't know. So somebody called me a dreamer a few months ago. As I said, you will share on one point, you will be able to share your data on one point across Europe, and you will be able to go to the doctor in another country to find care. But if we are stopped dreaming, and if we are stopped to be visionary, how can we move forward? And how can we build a better future? And we need to build, because healthcare systems are not there anymore. They are broken, they are damaged. And therefore we need new visions to go forward. And therefore I think it's realistic. We have to do a lot of work, but let's do it. And what I also want to say is, don't focus on to be perfect. Allow to make mistakes, learn from that mistakes, and make it better. Also to make sure that we grow the knowledge, and also to be a little bit faster from time to time, because we are discussing so much to be perfect, but nobody starts to do it. And I think sometimes we can allow ourselves to be not perfect, and then move forward and see, okay, this was maybe a mistake, and we should learn from that, we should make it better, and then move forward.
Thank you. And from the practical point of view, I said you were based at your hospital in Valencia. What kind of measures is your hospital taking to prepare for that, for what's coming with the European health data space and with this digital perspective?
Well, it's extremely important that hospitals work on, let's say, modernizing their digitalization. The hospital data space, the data warehouse has to be well-defined, extremely digital, allowing the secondary use for management and research, using all the standards and interoperability models to exchange their data with other hospitals, being able to construct that, let's say, in some way, perfect world, where data is there and you will have access to the data on the highest quality. No? So we really need dedicated units for data and information management. We really need policies on data governance, how to share, exchange, and use data properly. We need computational equipment. I mean, we need to invest for the renovation and maintenance of those machines. And we need people really willing to check, evaluate, define, incorporate, and innovate with the new tools we do have at hand. And to do that, in my hospital and most places, they are defining like single access windows and transformation digital units, innovation directorates, trying to incorporate all those issues to the data daily routine to allow the place to take part, not only on research projects, but also on highest quality standards of medical issues. Yeah.
Because that's, whenever we do, so I'm a researcher and we research stuff around things like the implementation of digital health. And we talk a lot about, obviously, the technical standards, but I also wanted to maybe ask you to say a bit more about the human side of this, because in the end, listening to what you're saying is hospitals with digital innovation directorates. Like this is not something that we would have seen even 10, 20 years ago, right? It's people who are driving this change. Do you see a need for different types of people, for different kinds of skills?
What I do see is that people are knowing that most of this revolution in healthcare is facilitating their life in some way. The seamlessly integrated approaches we try to perform in the hospital are helping physicians. And if whatever tools we do that on a transparent way, engaging physicians and patients, showing the benefits of having new tools, structured data, and forgetting, let's say, all ways of perform medicines just in front of the computers without seeing the patients, with no time for. I mean, physicians need time, trust, and tools to do their job on an easiest way. And if you provide that, at least that's my understanding in my own place, more and more physicians will be extremely proud of being part of this digital transformation of the healthcare.
Thank you. I will be interested to hear the reactions from people when we get some more reactions from the newsroom on that. Let me come back to one of the words that you mentioned there, and Birgit, I'm going to come back to you about trust, which you mentioned earlier, and I think it's one of the other big questions about implementation. So at least in the country that I know best, there have been some very large efforts to try and implement national data systems. And I think they've run into technical difficulties and all sorts of other challenges, but at the core of it was trust. So, or rather a lack of trust, and that really hindered that. So what's your perception of the safeguards that are built into the EHDS? Marco mentioned things like the full respect of the data protection rules, for example. But from a patient organization perspective, what's your perspective on the balance that the regulation is striking?
This is a good question, and it's a bit difficult to answer because the thing is, laws and regulations are mostly formulated very, very difficult. Lawyers write that. And to understand what's going on in that law is absolutely hard for patients' organizations. We are not lawyers. We are doing another job. So therefore, we would love to have, I would say, a translation to know more about it. And I think that would be also helpful to generate the trust. Because I think we have already something in place what helps us to make sure that data are protected. We also have the privacy issues discussed for many years now, and I think we are on our way to create a framework what keeps the people safe. And the thing is that the patients don't understand what's going on, so I'm trying to explain as good as I can. You don't have to be the troublemaker because you feel not secure or safe with your data. You have enough tools. And on the other hand, we also have to find out, and this is one example, and you can always be a bit provocative to the people, is we're sharing news via WhatsApp, we are using Facebook. Hey, we are doing social media. We don't ask, is this secure? Are my data safe there? No, because we do it. We said, yes, cookies allowed, and then move forward. So I think we have to find a balance in between the laws and explaining the laws, and also letting them know, hey, you are sharing your data already, but you do it not very consciously. This is the thing. So I think we have tools in place, and we can do something with it. And we need a better communication also for the patient organization. This makes our lives or the lives of the patient organizations much easier, also in explaining the things. And also I would say, I had the great honor to work on one of the laws was established in Germany. It was the Gesundheitsdatennutzungsgesetz. It's the health protection data law. And we were able and invited to comment on this. And this is what we need more. I would say do it together and run together, and then we can also solve these issues or questions.
So I note that as a real sort of message from both of you, actually, is this engagement and explaining and doing it in a collaborative way, which I think is a really important message. I think we're very tight on time, but if you had, that's a nice message to end on, I think, in terms of the importance of that collaboration. You've described benefits which are there, an interest and a motivation from professionals, and I think this is a really nice basis to take forward the discussion now for some of the next phase when we talk about some of the people who are aiming to achieve this. Colleagues, would you please join me in thanking our panelists in this perspective from a patient perspective and a professional perspective at the start of our discussion about this. So, thank you very much. Perhaps now, Floris, I don't know if there are, if that's struck any particular inspiration in terms of cartoons that you would like to show us at all. So I think we very much recognize that. So data is not always shared in interesting ways. Well, I'm sure we will address some of these issues as we come to the next one. And Mario, are there any other key messages which strike us from the Thank you, Flores. Are there any other key messages that strike you from the newsroom?
Yeah, and they keep coming. So one question which has caught attention was, will there be any adverse effects of EHDS, and how do we avoid them? And also, with health not necessarily being still on the top of the agenda, is there a risk that political interest in EHDS fades and that implementation will suffer?
Well, the risks and maybe a lack of motivation and interest, I can absolutely guarantee you that there will be no lack of motivation and interest from my next guests who come up on the stage, who are all, I think, thoroughly committed to this, because these are people who are very much involved in realizing the benefits that we were hearing from the patient and the professional perspective. So may I invite to come up onto the stage Uwe Heckert, who is Head of Enterprise Informatics Europe and Managing Director at Philips. Marco Marcella, who I think we all know by this point in time. Katia Pinto, who is Head of Global Digital Health Department and of Shared Services at the Ministry of Health in Portugal. And Barbara Preinzak, who is Professor for Comparative Policy Analysis at the University of Vienna and Chair of the European Group on Ethics in Science and New Technologies. Colleagues, please join me in welcoming this group to the chair. So we've heard about opportunities and a real potential from both the patient and the professional perspective, but also both from those colleagues and also Flores has highlighted, and we've heard from the newsroom as well, some of the challenges. Katia, perhaps I could come to you first and ask about, from your perspective, in terms of looking at this as someone responsible for this within a member state, how can the European health data space assist in overcoming this challenge of ensuring that data is shared and used effectively across health systems? How can we achieve that implementation in reality that was being questioned? And do you need any additional support, and what might that be?
Thank you. I see there's a lot of expectation around the European health data space, but I need to start by saying that this regulation, it's not something that just happened in a vacuum. It is the result of more than 10 years of work done by member states under several EU co-funded initiatives that actually teach us what needs to be regulated so that data can flow freely across healthcare systems in Europe. And it is a transformative regulation because for the first time creates a governance model for health data across the EU, and creates a governance model that already foresees a legal framework, an organizational framework, and a technological framework for member states to cooperate so that health data can flow freely across healthcare systems in Europe, while allowing full control for citizens regarding the way they want their data to be shared. For those of us working in public health surveillance for a long time, we know how needed a governance model for health data is across the EU, because we can also recognize that it will not happen by chance. All of us today are able to walk around with all our emails in our pocket, but we still are not walking around with all our health data. So there are several global commercial drivers, what we now can call digital determinants of health, that operate beyond national control. And that's why this regulation, it's a fundamental piece of regulation to overcome national challenges in interoperability. So it's not only about EU interoperability. It's really about national interoperability because it addresses global drivers that would be really difficult for member states to address on their own. So that's why I am extremely hopeful that this long time now work that we have been doing will actually implement a good governance model for health data across the EU that will enable the much needed digital transformation of healthcare systems.
Thank you. And it's a really striking point that you make there, because we talk so much about that balance between national and European and what should be, and sometimes it feels like a bit of a zero-sum game. It's either national or European. But what you're saying is that here the European helps achieve the national level. Do I understand correctly?
Yes, in the global digital world, we need to understand that the determinants of health are no longer only determined in our local daily practice. So there are global drivers for all determinants of health. We can think about environmental health that we've been talking a lot during this conference. We can think about behavioral determinants of health. All of them have market global drivers that influence the way people behave in their local communities. Data, it's no different. We need to understand that we moved from a reality where data was collected by healthcare institutions about us to a reality where we are the ones collecting data, and we need to be able to allow that data to flow freely, to evolve, to have the healthcare system that we need, one that uses telehealth, one that uses home care, telemonitoring, to provide us the best possible care. So that's why local realities need to be balanced with global drivers. And so global action needs to be taken regarding data for it to actually, or for healthcare systems to actually realize this vision of a data-driven healthcare-related decisions.
Thank you. That's an ambitious vision that you described there. Barbara, may I turn to you? We know that the issue of trust came up earlier, and I said we'd come back to that because I know who to ask about this. You've done a lot of work on how we reconcile the different ethical issues, the different challenges that we need to balance in this space. We were discussing it this morning at your excellent session on data solidarity over breakfast. What do you think about how the balance is being struck here and how best we should be striking the balance in this area?
Thank you, Nick. So I'm not going to repeat all the things that colleagues have said about what's good about the vision of the European health data space. I agree with almost all of them. An additional advantage is maybe a move from really thinking in terms of data types to shifting towards thinking about the purposes of data use. So as a kind of paradigm shift, it's a very positive one. Having said this, and you mentioned trust, we talked a lot about improvements for patients, and here it's clearly wonderful if data flows freely, but there's also concern, and we know that nowadays a lot of people feel worried about sharing their data, not only their health data, their data in general. There's concern about other uses of health data, so uses of health data for research, by companies, by governments, and it doesn't matter whether we say, okay, some of those concerns are unrealistic, these concerns are there. So to build trust, and I'm grateful that you mentioned the data solidarity approach, Nick, because that approach is one that we develop at the University of Vienna in collaboration with the Digital Transformations for Health Lab in Geneva. That tries to really emphasize the point that not all data uses are created equal. So not all data uses create the same public value. And what do we mean by public value? That's value for people and communities, and not only value for companies. So we know that people are very happy. So on average, people are very happy to share data when they can trust that the data won't be used against them, and when other people will benefit. So they worry when they either think that the data might be used against them, to discriminate against them, and I think there are very good safeguards against that. But also the worry about what society do we live in. It's not only about people's own data and their own individual privacy, it's about what society do we live in. And we need to move regulators, national governments, also the EU, that can be done, more can be done in the European health data space, that can be built into different workflows. We need to start treating data uses that create value for people and communities, different from data use that mostly create value for companies, and that will be a trust-building measure. And I'm not saying that creating value for companies is bad, but I'm saying that some of those profits that need to come back, they need to be shared with patients and communities in a better way. This does not detract from the value of the European health data space idea, but more needs to be done.
Yeah, thank you. Uwe, I want to come to you following that. Let's focus on the positive to begin with. Let's talk about innovation, because I think something that's come across very clearly from what Katja said, and also what Birgit and Luis said before, was there is enormous potential here. But actually, we think that a lot of this potential comes from new innovations, new technologies, things that are learned and developed as a result, and that's very much the kind of work that you and your colleagues do. Yeah. Tell us about what you think might come out of this European health data space.
I mean, innovation is indeed the key word here. So at Philips, we have been doing this for 130 years, now focus very much on, actually exclusively on healthcare. The mission is to improve the health and well-being of the people through meaningful innovation. That is actually what we are striving to. And there's actually not a lot of options or alternatives to this, because and I want to remind us also on the status of the healthcare systems, we have an ever-increasing demand for healthcare. So aging population, more demand, and then we have, it's already expensive, or it's actually costly. And even if we had the money, we wouldn't find the people to basically handle the things. So innovation is actually required. It needs to be people-centric, and we need to use what we have, which is actually very much the data. We need to create actionable insights out of these data, and then we can actually drive innovation. So it's all about really making the quality of treatment better, also doing already prevention. That is also helpful for the system. It can come via innovation. It's also to make it actually more cost efficient, and all this is a big driver is the innovation here. Now, where do we stand today? We obviously lack to a large degree consistency of data, access to data, digital data as such. That is actually where we are, and we really need to work on this. And it's not only for the individual players of the ecosystem itself. So it's not only for the hospital, it's also going across this, hospitals between hospitals, hospitals with insurance companies, and it goes also abroad. By the way, it also affects the startups. We are basically, sometimes we wonder why we are not being so fast as other startup environments on the planet. I was recently visiting a startup campus which we have in Germany. They said only one thing to me: please provide me a better, secure access to data. That is actually what we need to innovate faster. So that is actually where we need to go and where we want to go. Now, the health data space is one solution for this. Yeah, so it closes the gaps also for just purely primary use of data, but it also helps to innovate. It allows us to basically generate or to do evidence-based medicine, which is then addressing all the problems which I mentioned in the beginning. Mm-hmm. This kind of supply-demand gap that we are seeing, so we're going to be faster and better. And the health data space will be able to provide this, or it's actually shown already that it provides this, with a more uniform access to data, management of data. So that is one thing. It provides very clear regulation about data privacy, data security. That is also very important. We talked about trust. Everybody wants to have this. It improves also interoperability, which is one of the key themes in nowadays world. So systems need to talk to each other in order to get some benefit out of it. So that is all going in the right direction. What is required is really a harmonized implementation on a European level. So we need to, my view and our view also as a company is we need to get away from the state by state, little unit by little unit, kind of looking at things. If we want to be successful as Europe in the global scheme of the things, we need to basically do this together, and it needs to be obviously also funded.
Well, so let me go from there to you bring in the point that Barbara raised about, back to still for you, about public value. So I understand the interest for Philips, and of course we get benefits from technologies as they're developed. But if people are putting their data into this, how can they see and be part of the value that you also generate out of this? So there's public as well as private value.
The value comes through better treatment, faster treatment. So it's obviously not, I mean, it's not that I'm handing my data in and then I get something back for it. But the system works more efficiently. The waiting times will be reduced. The treatment is better. We hopefully pay less payment for the insurance companies. So that is all what is coming back. So I would also see very much the opportunity. We tend to see, to be honest, we tend to look a lot at the risks all the time and what could happen. We tend to lose sight of both the constraints we are in, which I mentioned before, cost, aging population, but also we tend to lose focus on the opportunities it brings. Yeah? So, and better treatment, a more specialized treatment, faster access to doctors, maybe even home nursing, home care. This is actually what comes back.
I have a feeling that we might come back to that topic, but what I want to do now, before I turn to you, Marco, to talk about, because we heard earlier about the importance of things like awareness raising, and I want to ask you about what's being done in that direction. Could I turn to you, colleagues, to Floris and Mario, to give us some reactions? Perhaps Floris first, you would share with us any cartoons. I think that's one for you first, Barbara. Data types. Not all data is created equal. Has different uses, maybe. I'm not sure if this is completely within your jurisdiction, Marco. Well, Mario, any reactions from Slido?
Yes, a few reactions. First, Birgit Bauer's intervention has actually sparked quite some discussion online on patient involvement and involvement of patient groups in general, be it through potentially EU for Health funding, specifically going to patient organizations to explain EHDS, potentially use tools and add data coming from EHDS for their advocacy purposes, etc. So a lot of reflection on patient engagement. Then a few more questions whether EHDS will be enough to bring Europe back to the innovation frontline. So are we going far enough? And will it be a strain on certain actors in the ecosystem? And then can we help those in particular and create incentives? And so there were quite some comments around data holders in particular. And related to the very last discussion around value created through EHDS, there was a question whether the so-called health data access bodies can play a role in assessing the value that is being created.
Perfect, thank you. I'd like to pick up a couple of those, but this point about people understanding, about the awareness. What is the Commission doing? What's being done to help people realize everything that, I mean, obviously, everybody is watching this session online, so they will all be perfectly informed. But for those few people left who are not following the European Health Forum, Gastein.
Okay, for those few left, let me pick up two elements and then I will elaborate on awareness and why we are going there. So first, the first element I want to pick up is what Katja was saying. So this is not something that emanates from scratch. This is being underpinned by, first of all, a strong systems of collaborations between the member states and European Commissions. And I must say, Clemens is here to be, and I guess that one should, I personally feel that we should thank him for his work with the EL network when we were first discussing the way in which the health data could be shared in Europe. Now, these strong mechanisms that led to, say, the first exchange systems between certain categories of data, for instance, the patient summaries, so the basic information about myself, or e-prescriptions, they stem from exactly that governance systems with the member states. And now, the European Health Data Space Regulation comes as a follow-up to that, especially on primary data, but also from the realization, especially during the pandemic, that we didn't have enough data to get to the conclusions that we needed when it comes, for instance, to address, well, at that time, the COVID, but not only that, even in general, the way in which we address diseases. The key point is that through that discussions between the member states and the stakeholders, the regulation comes with, as you say, a very strong layer of, say, elements for protections of privacy, ethical principles, and even the structures that are created. It's not about creating one repository that then everybody can actually look into it. I mean, it's far from that. This is about member states taking responsibilities for storing the data in a secure way where it is, and creating, on the top of that, the organizational infrastructure that evaluates whether certain requests are valid or not. And that's where the European Health Data Space makes the huge difference, because it tackles exactly those points to generate trust of what you can do and what you cannot do with that particular data. And of course, there is always the possibilities for citizens not to engage into this exercise, even for sharing data for, say, primary reasons. And in that sense, without that component, yes, you would undermine the trust into the systems. Now, to get there, again, the fact that we are not moving from scratch does also highlight the fact that we need to explain what is in this, in the regulations, and what is new vis-a-vis what we are already doing now. By the way, if you take Finland and Estonia, they are already using part of this infrastructure to exchange the data. It's already a reality for some of those elements. Now, I take from the conversations before that our idea to create the questions and answers on the text is a good one. So yes, so we will certainly work, number one, on, let's say, creating this awareness at the levels that, or tailoring it at the levels that, addresses, for instance, the organizations that you were mentioning before in your interventions, Laura, but also for the competent authorities to create what they have to create in the member states. So in a way, there is, specifically for the part on secondary data, actions needed for capacity building that include the skills. And now how we are doing that? We are leveraging the funds in EU for Health in capacity building terms, for instance, by mapping in relation to primary use and secondary use what is needed in the member states. And then we intervene, say, with available funding, but also with twinning schemes. And these twinning schemes are a mechanism that we already used in the past that would allow, say, to diminish the gap with those that have already advanced in using digital technologies and those who have to develop that capacity in the member states. So in addition to, let's say, engaging directly with those who can multiply let's say, the awareness about the content of the European Health Data Space, we are at the same time working with the member states, again, through the through the EU for Health program, to make sure that we develop the technological underpinnings at European level, but also at the member states in a timely manner. And we hope that by doing so, we also anticipate the way in which this will be uptaken in the future.
Thank you. Can I ask you a slightly more awkward question? Which is about we know that there are different we talk about, about the European Union as a whole, of course we do, but we know that there are digital divides and resource divides within and between member states throughout the Union. Sometimes there's discussion that digital tools can be a creation of more divide, if you see what I mean, because some people have the resources to access them and some don't. What are you doing to try and ensure that this is a way of bridging and of reducing divides rather than of exacerbating them?
So this is a work that involves a continuous discussions with the member states in the context, say, of the structures that we have at European level. As you rightly say, the assessment of the digital readiness is one of the elements that one needs to take forward, especially to go from where we are now to full, say, mainstreaming of the European health data space in 4 years' time. Now, the element that is important is that in terms of rights, every citizen will be having the same rights of the European health data space, which is a regulation, so it will be, therefore, immediately applicable. That's number one. Number two, in terms of technological readiness, this is where these activities that we are conducting on awareness raising, but also in understanding, so the maturity level in terms of digital will serve us, because then we can use the funds, and when I'm talking about funds, I go beyond the European health data space, but rather look into the plethora of funds that we have at disposals today already for the modernizations of the infrastructures that are needed in Europe. And we have advanced that job. So again, this is not something that we will do as of now, but we have done an important strand of that job under the recovery and resilience funds, because there you have a significant amount of money that went into the digitizations of health and care, specifically in creating the infrastructures for accessing data for purpose of clinical purposes and beyond, also for digital purposes.
So do you see, because we had a session earlier in Gastein on investment in health, and that discussed sort of facilities like the technical, like a wide range of tools. Do you see all of those as potentially helping to address this?
Yes, and sorry if I go back again to the power of data, but that's where this is our say work. So we need to generate insights for the policymakers, and what we are doing there is that we are putting together these information, even in the context of the semester, where we produce recommendations for the member states, because essentially where we are and where we are going, again, the visions that we have shared should also lead to smart investments and allocations of funds to specific. And we need to be able to use the right funding instruments for addressing the specific issues that are relevant for, going where we have to go. So this going hand in hand, mapping and having the funds at disposal for addressing that, it is by the way, in these sessions on the smart investment, it was also pretty clear how important it is to talk to, let's say, the member states, but also with the national and the regional authorities, for them to express their needs. So this mapping is fundamental for us to get where we have to get.
So to have so both the resources, but also the understanding of the needs to really be able to address them. Colleagues, we have, in order to finish on time, we will need to be brisk in the final comments. But I do have one more question for each of you. We hear about this, the concern that was raised from the newsroom about, for example, is this going to put the existing system under strain? Is this going to work in practice, basically? Katja, you're looking at this from within your member state. What's your sense of how is this implementation going in at the moment? Does it look as though there are good examples? Is it really stretching the system? What's your perception?
Yeah, I think the building up of the regulation of the European health data space, as Marco was mentioning, already proved to be very beneficial for most member states. Because in relation to what you were saying about the different levels of digital maturity between the different member states. The tools that we have been developing in several done European-funded projects already supported member states that were lagging behind. And for example, the European electronic health record exchange format is one of such examples where the technological assets and the standards put together in order to make this format and this electronic health record a reality already supported many member states in moving forward with their own national plans of digital transformation. But let me make it more concrete and bring up some of the examples that we already have in place that really showed us that the European health data space can be the way forward to make data use a reality in our daily work. One is the patient summary. So the patient summary is a short summary, as the name says, of the electronic health record, of our national electronic health record, and is a very concrete product of the European electronic health record exchange format that it's already available and shared between different 15 member states across the EU. That's a short summary of our health status available in our national language, but also in the language of the patient, the country of treatment. So this is an example where the European health data space building up is already proving value in pushing forward digital transformation. Another good example is the cross-border e-prescription. We already have in place between member states, and Portugal already connects with 12 different member states. We are actually the country in the EU that connects with the highest number of member states so far, where a medical doctor in Portugal can issue an electronic prescription and have it available or retrieved in a pharmacy in a different member state. So this is also an example of how the development of the European health data space can move forward national digital transformation plans.
Thank you very much. Those are striking examples. For sake of time, I will move on. Barbara, underpinning all of this, we still have these tensions about the ethics and how best to strike these balances between the private interests and the public interests. Are there any particular mechanisms or approaches that you would like to see incorporated into this that you think might help to better strike that balance and help people to see the public good that's coming out of this?
Yes, and I would like to read one comment that, because I'm good and I look at Slido when you tell us to. So one comment that I saw on Slido, which was, "Industry, please stop telling us health gets cheaper because of digitization, 3 exclamation marks. And I think whether we like it or not, saying that people should give their data and in return they will receive better drugs and better technology, that is not good enough anymore. And this is not a normative statement on my part, it's an empirical statement. This is not a measure that builds trust anymore. So you asked me for specific solutions, and I'm very happy to go into that, of course, very, very briefly. So one would be, this is something that in the data solidarity framework we're exploring, is benefit sharing agreements. They've been tried with some problems, but they've been tried in natural resource mining. They can also be used in data mining. So that would mean that a hospital that shares patient data with industry, that some of the commercial profits from that would also come back to the community, not to individual patients, but to communities. So there are lots of policy instruments that are available for that. It will be needed if this is going to be a success. And last but not least, can health data access bodies, this was one of the questions, can they play a role in assessing the public value of data use? I think exactly right. This is exactly the place where it should be. And there's a tool available, it's called the Pluto tool, that can actually help with this assessment, not only to health data access bodies, but any organization that's interested in assessing the public value of the data use.
Thank you. Thank you for some really concrete proposals about how we can better realize that. Finally, Uwe, if I can come to you. One of the questions, so we have questions about does it go too far, but then on the same side we also had the question of does it go far enough? What do you see as the potential here? Will this really transform the innovation landscape in Europe? Will it enable Europe to compete also at a global level in terms of giving European citizens access to innovations first?
Besides the fact that there is, from my point of view, no alternative to this, it's creating a lot of opportunities. It's enabling us to do completely new things for the benefit of the society, to solve the challenges that we have ahead of us. It enables us to do partnerships that we have never seen before across the countries. And just let me give you 2 examples. And examples are, by the way, the best thing to provide trust or to generate trust also. One is the Cancer Image Europe project, which is already building on the health data space. It's a federated infrastructure. It goes across the country borders. It allows faster diagnosis. It allows better treatment for the cancer. So that is one example. Please really do look into this. Use it also in the argumentation. And the other project is about, it's called Indicate. It's about to lift off. And this is about looking at the data or integrating and making insights out of the data coming out of an ICU. So everybody who has been, probably everybody has been already close or in an ICU in one way or the other. There's loads of data. It's really about making the right decisions. And coming here to more insights, data-based insights treatment is actually what we all want. And that's why I'm a big supporter of seeing the opportunity and realizing the benefits, while, of course, ensuring that the regulation is in place, that we have data security and all these things. So that is a given for me. But I also want to emphasize again, there is not really an alternative to this. We need to do this together in Europe.
Well, and I'm struck by that note, because of course that was also Birgit's note, which was that we don't really have a choice here. We have to do this. And so I think we started with the patient saying we have to do this. I think we hear also from the Commission, from the public authorities, a clear message that we have to do this and that there are huge advantages also from the industry perspective. Barbara, I think that from your voice, also how we need to think more about making sure that people see the value in this, not just in the concrete examples, but also in the balance of values that are being struck. Colleagues, we are out of time, but I think this gives us a really excellent, the better understanding we promised of the European health data space and the potential, the challenges, but the need to make progress. Will you please all join me in thanking our excellent panelists for this discussion? Thank you. Thank you very much. Before we close, colleagues, it was already referred to that there are some figures who have been working in this space for many, many years. And so it is particularly appropriate after this discussion that one of the first places that I met Clemens was in far-sighted contribution to addressing the challenges of e-health a number of years ago, which I will not specify. It's very appropriate that I hand over to Clemens both in that role, but obviously principally in his role as president of the forum, to close this session and the forum. Thank you.
Thank you very much, Nick. In case some people in the room were tempted to falling over from their seats because of these discussions on digitalization of health, because it's such an old story in many ways, I just want to remember us, and the title says Democracy at Work, European Health Data Space from Concept to Reality. And I just want to remember us, the European Union is all about law. It is about the rule of law. It is about the regulation. And the wonderful thing about this new regulation on the European Health Data Space, that we do have a regulation now. Everything else was a concept. We had good concepts, good ideas, but now we have a regulation, and the regulation is pretty modern, it's pretty timely, and it's not only, and I stress repeating that, it's not only about data protection and privacy regulation and all the technology stuff involved, it's also about the patient's right that the digital data digital health data are used appropriately. And I already said it with the young Gastein, et cetera, and several times in other occasions. I might be the first who start litigating my right if there is not appropriate use of my health data and not my health data is not available. That's the progress, democracy at work. That's my final note on this panel, so I'm very happy and I'm very proud. Ladies and gentlemen, the European Health Forum 2024 comes to its end, and also allow me on a personal note, I'm an old pro attending this kind of conferences, but this time I was really, from my feeling, it was inspirational and emotional, very emotional, listening to the ministers and the colleagues from Ukraine, their role as heroes, a role they haven't chosen in a situation of war. And for every one of us, probably an unthinkable life experience these colleagues and the minister and all the Ukrainians go through. So very emotional touch, but it was also very inspirational. Many sessions, panels, and I think one of the things which we also were able to show that there is a link between poor health services, poor health care, and the weakness of democracies and the perils of our democracy when populist movements are getting stronger and stronger, and maybe even getting the majority of the electorate behind, which we're already witnessing in some of our EU member states that this is the case. The second inspirational thing I experienced, and I was really, God gets me thinking, is that we really have also to rethink very strongly the concept of and our basic understanding of the social contract. We not only have to strengthen our old, and I don't want to say it in a negative way, but the principles of solidarity. We have to repeat them all over again and again. But we have to make this idea of a social contract also more tangible with our new challenges and include them. You know, when it comes to digitalization, for example, when it comes to the shifts in demography, et cetera, et cetera. So I think we probably inaugurated these discussions here at the European Health Forum Gastein, and I think we should carry that on, not only here in Gastein, but in many, many instances, and also bring it to the political awareness. And we do have to reframe our narratives in many ways, you know. When we say, and that was one of the lines in one of the sessions, that we need a Europe that cares, then we also have to show that Europe cares, and it cares. You know, what does it mean? It starts with the people, with the citizens, with the patients, and we have to exemplify that we care, and we do have to talk more about the harms and the reasons why people become sick. And what are the factors that people become sick, and why one of my favorite lines and quotes and what I witnessed is that Europe is changing in a very unhappy continent, you know, because of mental health problems, etc., etc. So we have to care about that and should start more about that. So that is my perspective, what we learned this 3-4 days now here in Bad Hofgastein at the European Health Forum, and I'm happy to continue these discussions within the forum here, but also on many, many other occasions. It is time to say thank you. First of all, it's an honor for us, the board, and all the people who are responsible for the European Health Forum, that you made your way to the valley and spent your time with us. I'm very much aware that this is not always easy to go away from your workplace for 3-4 days. So we are very honored that you're doing this. So thank you for that. But my second thank you goes, of course, to Dorli Gottlieb and our wonderful team of organizing this event. And I think they Thank you. So, well deserved, Dorley, and I haven't been aware of any glitch at this conference, actually. Maybe the rain, but we are not responsible for the rain, you know, so so thank you for this, and also thank you for our partners, the European Commission, WHO Euro for their strong support, and also the Ministry of Health of Austria, and with helping us getting this always alive. My last thing is to say, and on my script here it says, there's a lunch available outside. This was my last note, and my very last note is, thank you for coming, and I wish you all safe travels home, and see you next year, 2025, again at the European Health Forum. Thank you very much.
Shifting sands of health, democracy, demographics, digitalization. That topic reflects all the changes and the mega trends that we're seeing that are reshaping health systems across Europe now.
You have meaningful conversations with all the protagonists coming together in this amazing location. I don't think you can compare this to any other conference, because it's not just about having sessions and having a talk shop. It's about getting together, coordinating action, exchanging ideas, and putting them to work.
I went hiking with, someone from 2 Portuguese health doctors, multiple people from the European Observatory of Health Systems and Policies, people from the British Civil Service, people from European civil society organizations. And it's really, if you think about, what's that experience like? In what other context would I have the experience to, meet these people and socialize with them in a very informal setting, as opposed to only meeting them, say, if I engage with them on a professional basis at the OECD or at the European Commission? There's a very different dynamic there.
It's the perfect location to bring people together from different generations, from different backgrounds, to discuss really hot topics and keep coming back every year to see progress made.
I think it's great to be here, because we talk about politics, we talk about policy, we talk about health, and this time almost every day we talk about Ukraine. We talk about demography, digital, and most important, also the future of democracy. And it all comes together when we think about Ukraine, health sector, response to the war, but also the recovery and reform. So I'm happy to be here to see so many young faces, so many people, and so active dialogue.
Connecting with people that are at later stages of their careers, and connecting among your professionals. I think there's something extremely valuable about that. I go back to 2 years ago and some of the conversations I had when I first joined Gastein, and to this day, I feel like they participated in how my career has been going. So I think this is something I'm really grateful for.